Skeletal muscle mass, strength, and speed. The first supplement in this category is creatine, or methylguanidine acetic acid. We produce about 1 to 2 grams of creatine every single day from arginine, glycine, and methionine. These are amino acids that are found in the human body. And essentially, creatine gives us the ability to store phosphate in muscle as creatine phosphate. So we actually phosphorylate 60 to 65% of the creatine, and we store creatine in muscle as creatine phosphate or phosphate creatine. And this phosphate group, as you may recall from metabolism, is potential energy. So when that phosphate is attached to creatine, there's potential energy there that when you break that phosphate bond off of the creatine, that releases chemical energy, which we translate into mechanical work. Now we have quite a bit more creatine phosphate packed into type 2 fibers, which are those fibers that give us the ability to do higher intensity work and increase our force output to a larger extent than type 1 muscle fibers. So sources of this in the diet include any muscle products. So if we're eating the flesh of meat products, cows, etc., fish, eggs, you're going to get some creatine from those sources. It is endogenously produced, as I mentioned earlier, from arginine, glycine, and methionine. Now, one note that's kind of interesting that you may want to consider here, if you're trying to rely on dietary sources for creatine, is that overcooking any meat products will actually destroy the creatine. It actually denatures the protein and the amino acids fall apart, and therefore the function of creatine will be lost. So the claim here is that we can increase the amount of phosphocreatine stores in muscle. We can also, because of more stores now, delay the depletion of phosphocreatine and delay the amount of ADP buildup, which would cause some reliance more on other systems for energy production, so making ATP. So the more that you can delay this ADP buildup, the better off then you're going to be as far as stored energy is concerned in relation to creatine phosphate. So we can increase phosphocreatine resynthesis, which happens instantaneously as we're tapping into the phosphocreatine. You're also making it, which gives us the ability to work out harder. So we can increase our strength, we can reduce the amount of fatigue that we get, and therefore in the end, the goal is to increase protein synthesis so that we can increase muscle mass. So the idea here is that I can work out harder and get a really good workout and then provide that stimulus for muscle hypertrophy to occur. So the efficacy and evidence behind creatine, there are hundreds of studies done on creatine ingestion. I think probably it's one of the most popular, at least in the last 10 to 15 years, supplement-wise, that I've seen in the sport world as an ergogenic aid. So there's good evidence out there to show that there's increased phosphocreatine resynthesis during recovery bouts of high-intensity exercise. So it does work, but you need a high stimulus there, so it has to be high-intensity work. It seems to work really well for interval training. If there are multiple bouts, for example, of sprinting or circuit training, these sorts of bouts of activities where you're consistently working with a little bit of a break in between seem to benefit from creatine supplementation. It doesn't seem very useful for a single bout of exercise or a prolonged endurance event like a marathon. Nobody has found any sort of supporting results for that. It seems to work in well-trained athletes or elite athletes only when there is an increase in muscle mass. So if they're able to pack on a little bit more muscle, then that means that there's more room now for phosphocreatine to be stored. It also seems to work better in untrained individuals versus trained individuals, and in some instances, women responded more than men did as far as increases in strength and muscle mass from working out harder, from having more phosphocreatine. The side effects, one of the biggest concerns is the long-term safety of creatine phosphate ingestion, and no one's really looked at this in the long term, like 5 years out, 8 years out, 10 years out. So that's something that is lacking in the literature. Anecdotally speaking, athletes have reported nausea, gastrointestinal distress, headaches, dehydration, muscle cramping. There is the issue of increased water retention. Every time you pack more phosphocreatine into muscle, water is also going to be stored with it, which could be a negative aspect to it if you're doing some kind of endurance activity that requires you to be a little bit lighter than you normally would as far as having all that water retention goes. So that is a downside, that it does increase overall gain in weight, which could be a hindrance to endurance exercise performance. As far as megadoses that might upset the fluid balance and regulation, what happens if you have a pre-existing renal dysfunction? Creatine is secreted or excreted from the body via the kidneys, so if there's some sort of renal dysfunction, perhaps that might exacerbate that condition. That's one of the concerns. As far as the application goes, it's recommended that we reserve creatine phosphate ingestion for well-developed athletes that are training really, really hard at the same time. Typically, the doses are split 20 to 25 grams per day for the first 5 days, and then you do a 2 to 5 gram dose per day over the course of the next 28 days, and usually about 2 to 3 grams per day is a good maintenance dose after that initial huge dose in the beginning for those first 5 days. You can actually enhance the absorption with a high carbohydrate meal, so that's a benefit. We want to encourage that. One thing to understand is that about 30% of people, at least from the literature, don't seem to respond to creatine phosphate at all, so they may not see any changes at all in their ability to work harder as far as creatine phosphate ingestion is concerned. And then it takes about 4 to 5 weeks to return to baseline levels after consuming creatine phosphate. I threw this slide in here because it's kind of interesting to see creatine food sources. So I would have a look at this, and in case you're working with an athlete that's trying to increase creatine phosphate without actually using the supplement, this may be one way to do it. But you can see it's kind of hard to get the kinds of doses that have been used in the scientific literature through food. Okay, the next supplement is beta-hydroxy beta-methylbutyrate, or HMB for short. This is a metabolite of leucine. Leucine is a branched-chain amino acid. We do produce about 1/4 to 1 gram of HMB endogenously, and sources as far as food are concerned include catfish, citrus fruits, and breast milk. The claim here is that I can actually increase muscle mass, I can increase strength, I can improve my recovery, I can reduce the amount of fat mass that I carry around, I can use it as an anti-catabolic agent, I can even lower my plasma cholesterol levels and protect myself against oxidative stress. So there are a lot of claims to HMB. So as far as the efficacy and evidence are concerned, is related to increases in muscle mass and strength. There's limited evidence at this time, although it does look promising. There's some evidence that we can use HMB as an anti-catabolic agent. That is, we are going to minimize the amount of muscle mass or protein degradation that we're going to get, particularly in cancer patients and AIDS patients, or if I'm, for example, experiencing overtraining syndrome, so really intense exercise training. It may only work in novice trainees and for short duration, about 2 to 4 weeks. So is there an adaptation response to supplementation? These are things that we need to work on and figure out in the literature. As far as side effects are concerned, currently have not been any reported up to about 6 grams per day. So how would you use this? What's the application? It'd be 3 to 6 grams per day in a 2 to 3 divided dose. Okay, the next supplement, boron. It's basically a non-essential trace element that we find in the human body, in bone, in spleen, and in the thyroid. It's going to have an influence on calcium and magnesium metabolism and keeping that balanced. It's also involved in production of steroid hormones like testosterone. Membrane function is also an important regulator of, boron would be an important cofactor involved in maintaining the phospholipid membrane. So food sources, non-citrus fruits, leafy vegetables, nuts, legumes, prunes, applesauce, and even some wine all have boron. So the claim here is that I can improve my bone mineral density, or BMD for short. I can boost my testosterone levels, especially in postmenopausal women. I can enhance muscle growth and strength. So as far as efficacy and evidence, currently there's really a lack of evidence for increases in muscle mass or strength, but you can actually increase the amount of calcium absorption that you get from diet. So by having some boron in the diet, that improves calcium absorption, which would theoretically help with maintaining bone mineral density. As far as the side effects are concerned, boron, since it is a mineral, you do want to be careful with minerals. It is toxic. So if you're consuming more than about 50 milligrams per dose, then you may experience some of the toxic side effects. There is a potential for a decrease in performance simply because boron might give you an upset stomach. So if you have a tummy ache, you're less likely to consume the calories that you need and therefore may not consume as many calories as necessary for the amount of work that you're doing. As far as the application goes, about 3 milligrams per day is what it takes to experience some of these postulated claims. Okay, conjugated linoleic acid, or CLA for short. This is an isomer of linoleic acid, C9C12 octadecadienoic acid, which is simply a fatty acid. So it's a type of lipid. Where do we find it? We find it in meats, dairy products, usually in foods that are high in saturated fat. Some supplements commonly use vegetable oil sources, and these sources typically don't always show the effects of the postulated claims here, the purported effects. The claim is that we can get some weight loss from this, so we can reduce the amount of adipose tissue we're carrying around, and we can improve muscle hypertrophy, get muscle hypertrophy, make bigger muscles. In some instances, some suggest that we can improve our cardiovascular endurance performance, or that it's even functions as an adaptogen or even anti-cancerous properties. So there's quite a bit here. So the efficacy and evidence right now, it moderately promotes fat loss in moderately overweight adults. So as far as the other claims go, it's really hit or miss in the literature. As far as the side effects are concerned, there's some concern that it might lead to insulin resistance, that it might promote oxidative stress. We're not quite sure about this. As far as the practical application is concerned, about 3 to 6 grams per day for 4 to 12 weeks. Okay, octacosanol. Basically, this is a type of lipid. It's a fatty hydroxyl. So it's found in wheat germ as part of the lipids that are found in wheat germ. The claim is that we can improve neuromuscular function that would lead then to muscular hypertrophy, and in some instances even improve reaction time. The efficacy and evidence for this, it seems that there's limited data. However, there's some hope as far as the improvement in reaction time is concerned. So there may be something there. As far as side effects are concerned, None have been reported thus far. The application consumption of about 1,000 micrograms per day is what's recommended to see some of these purported effects. Okay, Tribulus terrestris. This is a Chinese medicinal herb. It's from the puncture vine and caltrop fruit. It's basically a Mediterranean plant that produces a fruit that then is extracted for this particular supplement. The claim is that you can increase athletic performance, increase sexual performance. It seems to stimulate luteinizing hormone production, which would be a precursor to testosterone. So the idea is that if you increase luteinizing hormone, then you'll increase testosterone levels and therefore have the benefits of increased testosterone. The efficacy and evidence, well, there's evidence that you can reduce angina or angina. So basically chest pain from having coronary artery disease. You can improve EKG if there are any arrhythmias present. It seems to improve them and also improve your libido. So as far as athletic performance is concerned, there doesn't seem to be much here. As far as side effects are concerned, frequent urination. The application of this is about 5 to 10 milligrams per kilogram of body mass per day to see some of these effects. Okay, and the last supplement of this lecture series here, vanadium or vanadyl sulfate. It's an abundant trace mineral. Our diet gives us about 10 to 30 micrograms per day, so it's not a huge amount. It is normally present in human tissue. Some of the food sources that we find this in: cereal, grains, oils, meat, fish, poultry. The claim is that we can actually improve insulin sensitivity, so you get more of a response out of the insulin that's produced. There's glycogen synthesis, so we pack more carbohydrate into muscle, which is related to performance levels. So the more glycogen that we can pack into the muscle, the more that we can increase our exercise performance. There's evidence that, or claim, that we can recover from exercise a little bit better, increase muscle size, and reduce the amount of adiposity that we're carrying around. So as far as the efficacy and evidence are concerned, currently there's no supporting evidence in healthy individuals for these claims, but there does seem to be something there with improved insulin sensitivity in type 2 diabetics. As far as the side effects are concerned, definitely need more research on this particular supplement. There are reports of diarrhea, cramps, nausea, vomiting, muscle cramps. These are aspects that can reduce an athlete's ability to consistently provide a large enough stimulus day in and day out. So you have to use this particular supplement with caution. The upper limit of intake on this is about 1.8 milligrams per day because it could lead to kidney and liver toxicity. The practical application of this is about 100 milligrams per day, so quite a bit more than what our diet is providing.